Right now, while you are sitting there, your heart is going through the most dangerous window of the entire day. Not when you are stressed at work, not when you are exercising, right now, in the morning. And the shocking part, most people over 60 have no idea this window even exists. I spent more than a decade watching people walk into the emergency department after ignoring the very signals their body was screaming at them for hours, sometimes days. And what I need you to understand before anything else is this: the four warning signs I am about to share with you. They are not dramatic, they are quiet, they are easy to dismiss, and that is exactly what makes them so dangerous. By the end of this video, you will know what to look for, what it means, and exactly what to do, because knowing the difference, that is what keeps you out of my emergency room. Before you type anything in the comments, let me ask you something first. Has your doctor ever sat down with you and explained why the morning hours are statistically the deadliest window for your heart? Just type yes or no down below right now. I ask because in all my years in emergency medicine, the answer I hear most is no. And that gap in information is exactly why I am here today. Everything I share comes from over a decade on the front lines of emergency care and from published research. But please understand, this video does not replace your personal physician. It is information, it is education, and what you do with it is your choice. Now, let me show you what your body has been trying to tell you. Here is what nobody explains. Not in a 7-minute appointment, not on the pamphlets they hand you on the way out the door. Your cardiovascular system runs on a rhythm. During sleep, your heart rate drops, your blood pressure dips, your entire system winds down and rests. But the moment you open your eyes in the morning, everything fires at once. Your stress hormones, cortisol, and adrenaline surge to get you moving. They push your blood pressure up sharply, sometimes 10 to 20 points within the first hour alone, then more again the moment you stand up. At the same time, and this is the part most people never hear, your blood is naturally thicker and stickier in the morning. You have gone 6 to 8 hours without drinking anything. You have been breathing out water vapor all night. You have been sweating into your sheets. So your blood is more concentrated, more prone to clotting. Think of it like motor oil that has been sitting in a cold engine all night, thicker, sluggish, harder to pump. So you have rising blood pressure, you have a faster heart rate, and you have stickier blood, all of them hitting at exactly the same moment. And if your heart has any weakness, any silent narrowing in those arteries, this is when it shows itself. This is not an opinion. A 2019 analysis published in the European Heart Journal confirmed that cardiac events peak dramatically between 6 in the morning and noon. 6 in the morning and noon. That window every morning, and most people sleep right through the warning signs that come before the event. That is what this video is about, knowing what to watch for before it becomes an emergency. Now, I want to tell you about a pattern I have seen dozens of times in clinical practice. Let me give it a face. Sandra, and I say her name to represent many patients just like her, was 67 years old, retired postal worker out of Virginia. She had high blood pressure that had been managed for years, thyroid issues. The kind of woman who showed up to every appointment, took her medications, did what she was told. One Tuesday morning, she woke up feeling more tired than usual, heavy, like she had not slept at all despite 8 hours in bed. She mentioned it to her husband. He said it was probably the weather. She agreed. And she went about her day. Wednesday morning, same thing. But this time there was something else, a strange feeling in her chest, not pain exactly, more like a weight, a pressure she could not explain. She thought it was heartburn. She took an antacid and made breakfast. By Wednesday afternoon, she was in my emergency department having a cardiac event that had been building since Tuesday morning. And here's what I want you to understand about Sandra: she was not careless, she was not uninformed, she simply did not know what the signals meant. Today, you will let us start with the sign that is least alarming but most commonly ignored: waking up exhausted after what should have been a full night of sleep. Not just a little tired, I mean, bone heavy, like gravity has doubled overnight, and getting out of bed feels like lifting something you cannot see, especially if your partner has noticed you snore loudly, or you stop breathing for a few seconds at a time, or you wake up gasping. This pattern points to something called sleep apnea. And here is why this belongs in a video about your heart. Most people think sleep apnea is just a snoring problem. It is not. When your airway collapses during sleep, your oxygen levels drop. And every single time that happens, your heart has to work harder to compensate over months, over years. This creates something like a constant low grade strain, the kind that quietly raises your blood pressure, disrupts your heart rhythm, and dramatically increases your risk of a cardiac event. Research from Johns Hopkins University has shown that untreated sleep apnea raises the risk of atrial fibrillation by 47%. 47%. And the majority of people with sleep apnea are not diagnosed because they do not know the morning tiredness is the signal. Now, I need to be crystal clear. If this sounds like you, do not panic. This is not an emergency, but it is a sign that deserves a real conversation with your physician. Ask specifically about a sleep study. And while you wait for that appointment, because waiting is the reality for most people, there are three things that matter immediately. First, if you carry extra weight around your neck and chest, even a small reduction shifts the pressure on your airways significantly. Second, sleep on your side, not your back. When you lie on your back, the tissue around your throat relaxes and collapses inward on your side. Gravity works with you instead of against you. Third, and this one is critical: alcohol before bed is one of the worst things you can do for sleep apnea. It relaxes the muscles in your airway and makes both the snoring and the breathing pauses dramatically worse. Cut it out in the evening, at least for now, because your heart is paying the price you cannot see yet. But here is what most people miss when they hear about sleep apnea. They think, okay, I am just tired. That is not a heart problem. And that thinking is exactly what the morning danger window counts on, because tired and exhausted are not the same thing. Tired means you need more sleep. Exhausted after a full night means something is stealing your rest. And when something steals your rest, your cardiovascular system never fully recovers. Night after night after night. That accumulation is what leads to the events I see come through my emergency department on Tuesday and Wednesday and Thursday mornings. So please do not dismiss the morning exhaustion. Write it down, track it, and bring it to your doctor with the word sleep study specifically. Now, I want to check in with Sandra for a moment, because what happened to her Tuesday morning connects directly to the second sign. The one that is easy to write off as nothing, she mentioned that before the chest pressure started, she had felt her heartbeat doing something strange when she first woke up: a flutter, a thump that felt off, and then it passed. So she ignored it. Do not make that same mistake. The second sign is noticing that your heartbeat feels different when you first wake up. Not just fast, different. Maybe it is racing for no reason. Maybe it is fluttering, like something small is moving in your chest. Maybe it skips a beat. Then another, or the rhythm just feels wrong, unpredictable. um, like a drummer who has lost the count. Now, the occasional skipped beat is harmless. Many people experience this. I want to be honest with you about that. But there's a specific type of irregular heartbeat that is not harmless at all. And the morning, that dangerous window I described earlier, is exactly when it is most likely to appear. It is called atrial fibrillation, or AF. And here is the mechanism in plain language. Your heart has four chambers. The top two, the atria, are supposed to squeeze in a coordinated rhythm, sending blood down into the lower chambers in an organized flow. In atrial fibrillation, those top chambers stop coordinating. They quiver rapidly and randomly. Think of it like a bag of wriggling worms instead of a steady pump. And when blood sits in those quivering chambers, instead of moving through efficiently, it begins to pool, to stagnate. And pooled blood clots and a clot that forms in your heart can travel directly to your brain. That is a stroke. A 2021 meta analysis from the American Heart Association found that people with undetected AF have a 5 times higher risk of stroke. 5 times. And the morning hours, when blood is already thicker and pressure is already spiking, are when AF is most likely to appear on a monitor. So here's what I want you to do. Not tomorrow, every morning while you are still lying in bed, before you reach for your phone, before you get up, take 30 seconds. Find the pulse at your wrist, just below the base of your thumb on the inner side. Feel the rhythm, count it. Is it steady and even like a metronome? Good. Or does it feel irregular, jumping, sometimes fast, then slow, then missing, with no consistent pattern? That second one is worth documenting. Write down the time, write down what it felt like. And if that irregularity is happening regularly, or if it comes with any shortness of breath, any lightheadedness, any pressure in your chest, do not call for an appointment. Call for help, because AF combined with those symptoms is not a wait and see situation. And one more thing here, if you have a smartwatch, many of them now have the ability to detect irregular heart rhythms. Not perfectly, not as accurately as a clinical ECG, but well enough to catch something worth paying attention to. If your watch alerts you to an irregular rhythm repeatedly, take that alert seriously. Show it to your physician. It is data, and data saves lives. Now, let me bring you to the third sign. This one is more serious than the first two. And I need you to stay with me here, because understanding the mechanism will help you recognize it instantly if it ever happens to you. The third sign is waking up unable to breathe comfortably when you are lying flat. There are two versions of this, and both matter. The first version develops slowly, quietly, over weeks or months. You find that you cannot get comfortable lying flat anymore without feeling a little short of breath. You have added a pillow. Some people end up sleeping practically sitting upright in a recliner, and they have been doing it for so long, they think it is just a preference. It is not a preference, it is compensation. Your body found a workaround because your heart was struggling. That first version has a clinical name, orthopnea, which simply means breathlessness when lying flat. The second version is sudden and frightening. It is called paroxysmal nocturnal dyspnea. You fall asleep. Then 1 to 2 hours later, you wake up gasping desperately with a suffocating feeling that forces you bolt upright. You need to throw open a window. You need air. You cannot get enough of it lying down. And sitting up is the only thing that brings relief. Here is what is happening inside your body. And this is the metaphor I need you to hold on to. Your heart is a pump. When a pump starts to weaken, it cannot move blood forward as efficiently as it used to. So blood begins to back up behind it into your lungs. Your lungs are like sponges. Normally they are full of air, but when blood backs up, fluid leaks out of the blood vessels and into the sponge tissue. The sponge gets waterlogged. And when a sponge is waterlogged, there is less space for air during the day while you are upright. Gravity pulls that excess fluid down into your legs and ankles, away from your lungs. You breathe okay, but your ankles swell. That ankle swelling that your doctor mentioned, that is not just aging, that is your body doing you a favor, keeping the fluid away from where it really does damage. But the moment you lie flat, gravity stops working in your favor. All that fluid drains back up out of your legs, toward your chest, into your lungs. And a healthy heart would simply pump it through. A struggling heart cannot. So the sponge fills, and you wake up drowning, not in water, in your own fluid. Sandra did not have this symptom, but I have watched enough patients describe it to know exactly what that moment feels like for them. The panic, the reaching for the window, the sitting on the edge of the bed at 3 in the morning trying to breathe. If this is happening to you, even occasionally, this is not something you monitor on your own. This is something you bring to a physician within days, not weeks, days. And if it happens with chest pain, or if your lips or fingertips have a bluish tinge, call emergency services immediately. Do not drive yourself. Do not wait for someone to come get you. Call. Now, before I get to the fourth sign, and this is the one I saved for last because it is the most critical thing in this entire video. I want to check back in with Sandra because what happened next matters. When she arrived in my emergency department Wednesday afternoon, her husband told me what he had noticed Monday night. She had gotten up to use the bathroom at 2 in the morning, and instead of going back to bed, she had sat in her armchair until 4. He had asked her why. She said lying down felt uncomfortable. She had thought it was her acid reflux acting up. She had not connected it. Nobody had told her what the signal meant. Now you know. Here is what Sandra told me later from her hospital bed. She said, I kept waiting to feel worse, like I needed some kind of obvious sign before I called anyone. And I want you to hear that because that is exactly the trap. Your body gives you small signs first, quiet signs. And if you do not know what they mean, you wait for something unmistakable. And by then, the window has closed. The fourth sign is the most serious. And I want to be direct with you about it because softening this message would not serve you. The fourth sign is any new chest tightness or pressure or heaviness in the morning, especially when you are moving around doing something simple, getting washed, getting dressed, walking from the bedroom to the kitchen. And this is important. The sensation is rarely what you see in movies. It is rarely a sharp stabbing pain in one spot. It is more often described as a heaviness across the chest, like a band being tightened, like something pressing down from the outside. Some people say it feels like an elephant is sitting on their sternum. It can spread into the left arm, into the jaw, into the neck, into the upper back. It often comes with sweating that seems out of proportion to what you are doing, feeling sick to your stomach, shortness of breath that arrives with effort. Now, there are two versions of this that I need you to understand. The first version, uh, pain that comes on with activity and goes away completely when you rest, is called stable angina. And stable angina is a warning, a serious one. It means your heart muscle is not getting enough blood. There is a narrowing in one or more of your coronary arteries. When you rest, demand drops. And the narrowing is manageable. When you exert yourself, demand rises and the narrowing cannot keep up. So you feel it. Stable angina does not mean ignore it. It means call your physician today and say, I am having chest pressure with activity and it resolves with rest. Those exact words, because stable angina, if addressed, prevents what comes next. The second version is the one that requires you to call emergency services right now. Pain that does not resolve with rest, or pain that comes on while you are at rest and does not go away, or pain that is the worst you have ever felt, or pressure that has been building since yesterday and is still there this morning. This is what happened to the man I think about most from my time in emergency medicine. He woke up with a tight, heavy feeling in his chest 2 mornings in a row. He attributed it to indigestion, heartburn. He thought the second morning felt similar to the first, and so he had breakfast and went about his day. He arrived in my emergency department in full cardiac arrest. My team got him back, but every minute of delay cost him heart muscle he will never recover. Tissue that died while he was waiting for an unmistakable sign. Here's the number I need you to write down. Every 30 minutes of delay in getting treatment for a cardiac event results in measurable permanent damage to the heart muscle. Not discomfort, damage. The cells that die during that window do not regenerate. And the difference between a full recovery and a lifetime of cardiac complications is often measured in minutes. So I am asking you, if you have chest pressure or heaviness in the morning, that is new, or that is lasting longer than a few minutes, or that spreads anywhere beyond your chest, do not call your doctor's office and wait on hold. Call emergency services. Call immediately. I know what you are thinking. I do not want to bother anyone. I do not want to be wrong. I do not want to feel embarrassed if it turns out to be nothing. Let me tell you something. In all my years working in emergency medicine, I have never once felt anything other than relief when someone came in and it turned out to be nothing serious. The only time I have ever felt anything negative is when someone came in and said they had been having symptoms since yesterday but did not want to make a fuss. Please make a fuss. Your life is worth the inconvenience. Now, let me give you the complete picture of what to do with each of these 4 signs. Think of it as a 3-tier response system. And here is the framework I need you to memorize. Not tomorrow, right now. Tier 1, book an appointment within the week. These are signs that need evaluation, but not emergency services. Morning exhaustion despite full sleep, especially with heavy snoring or observed breathing pauses, an occasional irregular heartbeat that comes and goes with no other symptoms. These are tier 1. Call your physician this week. Use the specific word sleep study for the first one and ask for an ECG for the second, tier 2. See your physician within 48 hours. These are signs beyond self-monitoring. Breathlessness that is slowly worsening when you lie flat, needing more pillows than you did 6 months ago. Ankle swelling that is new or increasing. These are signs your cardiovascular system is compensating and the compensation is getting harder. Within 48 hours, not next week. Tier 3, emergency services. Now, do not drive. Do not wait for someone to come get you. Call the moment you have any new chest pressure or heaviness that lasts more than 5 minutes. Sudden, severe breathlessness at night. A racing or irregular heartbeat that will not stop and is accompanied by dizziness or chest symptoms. Blue tint to lips or fingertips. These are tier 3. Every minute matters. Sandra recovered. She was in hospital for 4 days. Her treatment went well and her prognosis is good. But she sat across from me before she left and said something I have not forgotten. She said, I knew something was off Tuesday morning. I just did not know what I was supposed to do with that feeling. Now she does. And now you do too. If you have made it this far in this video, I want you to do something right now before you scroll anywhere else. Think of one person in your life who is over 55, your mother, your father, your husband or wife, your neighbor, someone you care about. Send them this video right now, because the information gap I described at the beginning of this video, the gap between what your body is telling you and what you know to do about it. That gap is what fills emergency departments every morning. Closing that gap is why this video exists. And if this helped you today, please hit like right now. It costs you nothing, but it tells the algorithm this information matters. And that matters to someone who has not found this yet. Now, I want to talk to you honestly about what comes next, because knowledge without action is just anxiety. And I do not want you to finish this video feeling worried. I want you to finish it feeling clear. So let me give you a week by week framework for what paying attention to your morning heart signals actually looks like in practice. Week 1, start a simple morning log, 30 seconds every day before you reach for your phone. Check in with your body. Is your heartbeat steady? Are you more breathless than usual when you lie down? Is there any pressure or heaviness in your chest? Write it down, pen and paper, just 3 words or a number. That log becomes the most useful thing you can bring to any physician appointment, because a pattern over 7 days tells a story that a single visit cannot. Week 2, you may notice something you had been dismissing, something you had normalized, the extra pillow, the morning fatigue that lifts slower than it used to, the ankle that has been slightly puffy in the evenings for months. When you name it and write it down, it stops being a vague feeling and becomes information. And information is power. Week 3, most people who start this practice tell me the same thing. They feel less anxious, not more, because the unknown is always more frightening than the known. When you know what you are watching for and you have a clear protocol for what to do, the morning is no longer a threat. It becomes information you act on. Some of those people discover everything is fine and they sleep better for knowing it. Others catch something early. That early catch, that is the entire point of this video. Here is what I also want to be honest with you about. Some of the signs I described today, especially the morning fatigue and the occasional irregular heartbeat, are very common and often completely benign. I am not asking you to catastrophize every morning. I am asking you to know the difference between something that varies from day to day and something that is persistent, worsening, or accompanied by other symptoms. That discernment, that is what I am giving you today. Use it wisely. Before I let you go, I want to preview something I will be covering in an upcoming video, because there's a piece of this puzzle I did not have time for today, and it is arguably more actionable than anything I shared here. There is a specific morning habit that a significant number of people over 60 are doing completely innocently that significantly increases the cardiovascular risk during that dangerous morning window. It is not medication. It is not a food. It is something almost universal, something most people consider completely harmless. That video is coming soon. And once you see it, you will not be able to unsee it. Make sure you are subscribed and have the notification bell on so you do not miss it. Let me leave you with the summary. 4 signs, 1 framework, morning exhaustion with snoring or breathing pauses. Tier 1, book your physician this week. Ask for a sleep study. Irregular heartbeat that comes and goes when you wake up. Tier 1, book your physician. Ask for an ECG. Breathlessness when lying flat, worsening over weeks, needing more pillows. Tier 2, see your physician within 48 hours. Any new chest pressure, heaviness, or pain in the morning that spreads or does not resolve. Tier 3, emergency services. Call immediately. One more thing before you go. Type I finish in the comments if you watch this entire video, and send it to one person you love who is over 55. One specific person, not everyone, not a group. One person whose morning experience might look different to them now because of what they learned today. That share might be the most important thing you do this week. Do not let anyone tell you it is too late, because it is not